This episode of Common Health is brought to you by Reg Lantern. Reg Lantern is a straightforward and easily understandable software platform built to assist community health centers in staying compliant so they can focus on serving their patients rather than paperwork. For health centers that are serious about achieving, managing, and maintaining compliance, Reg Lantern provides a comprehensive approach and is an affordable and valuable solution. Reg Lantern can help your health center. Contact them today at reglantern.com. That's REG, as in regulations, lantern.com. For special discounts, mention that you heard about Reg Lantern on the Common Health podcast.
Hello, listeners, and this is Tracy Douglas. I'm back to you again for another fantastic show. I just love doing these podcasts, as many of you all probably know. And again, once again, we've got a fabulous guest on to talk about the work that she's doing with the organization that she represents. But before I do that, listeners, again, we just want to say thank you for always coming on and joining Common Health here, based out of Virginia. But really, these are stories that we like to bring to you because although we say they're stories out of Virginia, I think a lot of what we share with you listeners really do pertain to many folks around this country and maybe even around the world. So with that, again, I just want to make sure I say thank you to all of our listeners, to the ones that always come back to our shows and to even some of the new ones that just joined us. So today, listeners, we have a fantastic person here from a company or an organization, I want to say, called Vot-ER, but I'm going to actually let her speak a little bit more. Her name is Bianca Navarro. And I got to know Bianca a little while ago. She and I were able to connect and talk about some of the work that she's doing and what's behind the mission of her organization. And the reason why we were able to connect is that, as you all know, Common Health comes to you started out from an organization, a membership organization that has members that represent what we call federally qualified health centers, community health centers out here in the state of Virginia, but they're actually throughout the country, which many people don't know that. We have about 1,400 community health centers with a little over 1 million locations throughout this country. And here in Virginia, we've got 31 health centers with a little close to 209 locations throughout the state. And so the work that Bianca is doing with her organization, they work with community health centers as well as other health systems out there. And so I really felt it was important that we brought her story and the organization's story to this show so that you listeners can learn more about some of the great work that they're doing. So with that, Bianca, thank you for joining us today.
Thank you, Tracy. And first, I want to start off by saying thank you for having me on the podcast, but also thank you for our partnership, because Vot-ER and VCHA, the Virginia Community Healthcare Association, actually recently solidified our partnership. So we are excited to work more with you all, collaborate with you all, but more so collaborate with the community health centers in the state of Virginia and beyond to weave in civic engagement work in their healthcare delivery. So thank you for having me.
Well, and with that, Bianca, I want to go straight into a term that you used in your statement there. You talked about civic engagement, right? Tell the listeners what civic engagement is.
So civic engagement is the way that our patients, our community members, our daughters, our brothers and sisters could actually engage in the electoral system. Civic engagement could look like a ton of different things, right? It could look like calling your politicians, right? It could be registering to vote, disseminating voting information or education. And that is really at the root of what Vot-ER does. And so we get back to the origin of Vot-ER as well. But civic engagement is a way that you could use your voice to advocate for the policies that reflect the needs for your communities, your family members, your patients, and staff members at your institution as well.
So with that, Bianca, talk to us. Tell us who is Vot-ER? What does your organization do? What's behind the mission? Why did it come about? And why it's so important as it relates to civic engagement?
Yeah, so Vot-ER is a civic engagement organization, but our origin story is actually from the healthcare side as well. And to give more background and context for the listeners of who Vot-ER is, especially for folks hearing it for the first time, I know the spelling is funny. It is VOT-ER, but it's pronounced Vot-ER. And we are a nonpartisan nonprofit that works to integrate civic engagement into the healthcare space because we know that communities with more inclusive voting policies and greater levels of civic participation have better health outcomes. And Vot-ER was actually founded by an emergency room physician. So that we're going back to the core root of our healthcare origins and why we feel strongly about weaving in civic engagement into the healthcare space. So our founder, Dr. Alistair Martin, he was an ER physician at Massachusetts General Hospital and saw firsthand really all of the challenges that a lot of his patients were facing were sometimes things you couldn't fix with a prescription. So when we think of things like housing instability, we think of lack of transportation, gaps in insurance. These were all policy problems that really highlighted this connection between health and civic engagement. And what kind of bred this idea of Vot-ER becoming an organization is Dr. Martin once had a patient that came in. She was living out of her car at the time and came into the ER looking for a place to stay. So she needed access to transitional housing. The only way that she could qualify was by showing proof of residence, which she did not have on her in the ER room. So Dr. Martin calls up the on-call social worker, trying to figure out how they could help this patient. And she let him know that actually, if we register her to vote right now, that could qualify as proof of residence, and we could get her into that transitional housing. The first question Dr. Martin asked was, we could register a patient to vote in the hospital. Is that legal? Can we do that? I think that would be a question any physician would have in that moment. And the answer was yes. So the National Voter Registration Act of 1993, the same act that allows and encourages DMV offices to register people to vote, actually encourages nonpartisan voter registration in healthcare settings. So not only is it allowed, it is heavily encouraged. So through that, they realized, okay, it's allowed. We could help her register to vote. They got her into transitional housing. And really from there, it was really like a moment that realizing that registering that one patient to vote could solve an immediate need for a patient, but opened up the larger and more critical idea that civic engagement can actually be a tool to address longer term health issues that keep showing up in hospital spaces.
Well, it's interesting that you say that based off of the story of the founder of the organization. Many community health centers and hospital systems are faced with their patients that are challenged with different environmental factors impacted. You spoke about that one example of a patient or an individual that was unhoused. And something as simple as registering to vote actually helped that individual get that housing. And because it really does make a big difference when it impacts their health care, right? If you're so focused on ensuring that you have a roof over your head, right? That's the one thing you're focused on, is just keeping dry from the elements. Okay. It's difficult to focus on your own healthcare, right? Because the only thing you want is to get something over your head, right? And so it's interesting how this formulated based off of some of those challenges that many of us in healthcare experience with people in communities. And so one of the things that's interesting that you had said too about the physician asking, can we register individuals to vote in a healthcare setting? Why do you think that question came about?
Because when you think of civic engagement or voter registration, you assume political campaigns, right? Like your instinct goes to, oh, that is something that happens in voter registration drives or political campaigns or issue-based campaigns that want to go and register voters. And I think people forget the more passive ways that people register to vote. Like, for example, I named that at the DMV office, they offer resources to help you register to vote. And it was not something that was thought about before, at least for our founder, until that interaction of realizing there's an entire act that names and encourages this kind of work in healthcare spaces. And I think what is so great about actually integrating voter registration and civic engagement in the healthcare space is because healthcare professionals, more than anyone, understand the needs of their patients that go beyond straightforward care, right? So that's really why our organization was founded. So we officially launched in 2019, but it was to do exactly that. It was to help healthcare professionals, healthcare systems, social workers understand that they could help their patients, their clients receive access to voting information that they need. So through that, Vot-ER creates the HIPAA compliant, completely free, nonpartisan tools and resources that make it really easy for those healthcare professionals and healthcare systems to offer voter registration information to patients, but not as a political act, just as a public health act to help bridge that gap between healthcare and civic participation. And another thing I really want to uplift too is that at Vot-ER, we don't just create these tools, right? We don't just create these voter registration, civic engagement tools and hand them off to folks. All of our resources are actually co-created with healthcare providers. So we work side by side with the clinicians, the community health workers, the nurses, the folks really on the ground to make sure that whatever tool or resource we're building works in real life settings for healthcare professionals. It works in the rhythm of a busy health center. It works in a busy hospital because we know how much is on our healthcare professional plate. So the collaboration between healthcare professional really makes Vot-ER what it is. We co-create these tools and resources, and we just want to make it easy. We want to take the lift off of the healthcare professionals that want to engage. So overall, our goal is just to scale voter access across the country through the healthcare delivery system to then improve health outcomes.
And so you just sat there said to improve health outcomes, because my question back to you is, why should community health centers, why should health systems partner with you to do this?
That is a great question, Tracy. And what I always say is that voting is actually one of the most direct ways to help create change in your life, in your community lives, and your patient's life. And that's exactly why it matters so much in healthcare. Because when we think about the things that impact health, it's not just what happens inside the clinic, right? It's things like whether people can afford their prescription, whether there's a health center nearby in their region if they live in a rural area at all, whether your local community health center is receiving enough funding, whether the water coming out of the tap is safe to drink, right? That has such a strong effect on health. These are all policy decisions and they're decided by people in office. And the only way to help influence those decisions is through the act of voting. And I think for patients, especially those served by community health centers, voting can be a tool to advocate for what their family needs. So that could be whether it's Medicaid expansion, funding for mental health programs or investments in safe housing. And then for the staff, for healthcare professionals, it's a tool to go beyond just delivering care, right? If you care about your patients, you would do anything really to help improve their health outcomes. And so doing this civic engagement work is just one way to advocate, not just for your patient's best interests, but for the best interests of your health center as well. So I always say this, if you don't vote, someone else is going to make those decisions for you because voting is your voice. But healthcare professionals are in a really unique position because they work with community members. They understand their needs. They're meeting folks where they're at. And I think if they really care about their health, one way, again, to integrate something into your care, your delivery care system that will in turn help benefit your patients. And I think that's what a lot of health centers that come to us, what they want to do. They just want to help improve the lives of their patients. And so through that, we've created a myriad of different kinds of tools that work for different health centers and different healthcare professionals based on how they want to integrate civic engagement work.
So let's talk about some of those tools, right? Can you provide us some examples of what some of those tools are that health centers and health systems will have access to? And then how do they actually use it when they interact with a patient?
Perfect. Yeah. So before I get into the tools, I want to start by emphasizing that all of these tools are free, they're HIPAA compliant, and they're nonpartisan. And we've crafted them in a way to be as non-disruptive as possible to the workflow of our healthcare professionals. And we look at them not just as tools, but really as invitations to action that fit in the pace and reality of different healthcare settings. So I'll start with our first tool. Our first tool is our Vot-ER badge backer. It is the bread and butter of our organization because it's actually the first tool we started using with healthcare professionals. It's this little card that clips in the back of a provider's badge or ID. It has a QR code or a short link that patients can scan that brings them to a landing page. And on that landing page, they could check their voter registration. They could get information on how to vote, what's on their ballot, their polling location. And what makes this particular tool so great is that it's really subtle for the actual physicians and healthcare professionals wearing the badge, but it also helps spark a conversation around voting with their patients. So that's one. And then we also offer custom digital materials. So this is an entire kit that we create that we send to our partners, and they can print things out. It comes with templates for posters, handouts, things that you could put in waiting rooms or include in discharge paperwork. We've also added little pharmacy bag insert templates that are really great. So it has all these kind of different printed materials that again features that same link and QR code that patients could scan or go to the website to go to that landing page to get their voting information that they need. But also another thing I want to name is that actually on that landing page, there is a 24/7 helpline. So if patients have any questions around the voter registration or voting process, around voting ID, if they can vote, all of those questions that might be a little daunting for a healthcare professional, they can live chat with someone through that helpline. So we have a really incredible partnership with Vot-Riders. They are great. They offer ID support. If you don't know Vot-Riders, you can look them up. They're a great organization, but they actually help run that helpline for us. So again, taking that lift off of the healthcare professionals. And then for sites that want a bit more of a passive option, we have now created electronic health record integration. So patient portals like MyChart can include voter registration reminders, and it makes that experience a bit more seamless. So the same way that a patient might get a reminder to schedule a flu shot through their patient portal, they could also get a link to make sure that they're registered to vote or that their registration is up to date. And again, this is customizable by the health center and our partners of what they want integrated. So we could do election reminders for the electronic health record system integration as well. And then I will go into my personal favorite tool and resource, which is actually the patient texting campaign. So especially for our community health centers, we create a texting toolkit where health centers could send voter registration and election reminders right through their existing patient platforms. So at Vot-ER, we create the toolkit that includes the recommended messaging. We include the customized links and schedules to make sure it's time to elections or key voter registration deadlines. But it is actually really great about all of our tools is that everything is trackable. So it is HIPAA compliant, so no one receives personal information of patients. But a health center that orders either the digital tools that runs a patient texting campaign or EHR integration, they get an organizational dashboard where they can actually track the amount of people that have started the voter registration process, the amount of people that actually registered to vote and when. So you can see what tools are working, when a lot of folks are engaging with the tools. Is it closer to the election? Is there a time in the year folks are more engaged? And so I think that's really like a key aspect of our work of understanding we want to do this work, but is it working? And It is, because I would say that our healthcare center partners, especially with the patient texting campaigns, we have had individual health centers that have helped over 1,000 patients get registered to vote. So the impact is large, and the ability to track that numerical impact, I think, is really important for folks wanting to continue to do this work year after year.
So when a patient is approached, would a health center provider approach the patient? I mean, what's an example? Can you kind of set up what that scenario could look like? Well, give us an example of what a scenario could look like.
Yes. So it can be, right? So when I mention the badge or some of the posters where they can vote with the tools that say ready to vote, get registered to vote, all these things are meant to prompt conversation. So a healthcare professional might, during the social history check-in portion of a visit, might say, do you smoke? Do you drink? Are you safe at home? Are you registered to vote? And they could integrate that question naturally. And if a patient may ask, well, why are you asking me that question? You could say, well, me and this health center are offering voter registration information that's optional to you if you want to check your voter registration, because civic engagement is tied to health outcomes. So we encourage you to get registered to vote if you're comfortable. We don't tell you how to vote. We are just offering this resource if you want to use it. So that is one example. But I'm glad you uplifted this, because actually on our website as well, an additional resource we have are talking points in conversation. So we get that a lot from healthcare professionals of like, I don't know how to weave this in at the beginning of the check-in, at the end of the check-in. Like, what is a natural way I weave this in? Or how do I talk to younger voters about it? How do I talk to people who are skeptical? And we have a ton of talking points on the website that allow you to have a little bit of those guiding conversations. So for anyone doing this work that wants to order their badge or materials, we also send them that script. We call it a script, but it's talking points for you to start getting comfortable on how you could weave these talking points with your patients as well.
Wow. I'm curious. You've outlined so many different resources that health systems and community health centers can utilize to help their patients, like you said, register to vote or bring the attention around their registration, and really how important it is on not just themselves, but just on the overall healthcare of their communities. Going back to your founder, where is he now? And I'm curious as to what his thought process is relative to what his perspective was back then, and then what his perspective is today. Do you by any chance stay in touch? Is he still involved with the organization?
He is very much still involved in the organization. And you know what? I'm happy you're asking this question, because I think it moves into something else of like the political environment changes a lot, right? So the civic engagement and voter registration piece is very important. So he's still a practicing physician. He still goes to the hospital. He still helps run our overarching, we are Vot-ER. We are one organization under what's called a healthier democracy. And that is really the umbrella organization that he oversees. So he does a ton of beautiful, incredible work that helps essentially increase civic engagement, but also there's an organization called Link Health that helps offer internet connection services to patients served by community health centers. So if folks want to look him up in the work that he's doing, he's great, but he's still a physician first and foremost. But there has been a lot of conversation due to the political environment around voter registration, civic engagement, and also just our healthcare partners wanting to do a little bit more. So I think one thing that I say is that as the environment changes, our partners, our healthcare centers want to do things that are different, or they want to do more. They want to evolve, right? With the things surrounding them. And our goal at Vot-ER is to always tweak and tailor our tools to what our partners want, what our health centers want, what our social workers want to do. And so more recently, I think we've continued to evolve based on what the partners are telling us they need at this time. So an example I'll use is we've actually started offering tools that support not just civic engagement, but advocacy work. So just like how we have a texting toolkit that helps patient gets registered to vote, now we also are offering a Medicaid defense call to action texting toolkit. So this is our way of dipping our toes into the water and testing something new in the advocacy space on a bipartisan issue. So still very aligned for our organization. And in that toolkit, we offer pre-crafted messaging and a link that our health centers can send to their patients that offer a step-by-step guide on how to call their elected officials. So I talked about that earlier, but how can patients get further engaged? And it's not just the patient-facing tools. We've also created those templates so that health centers can engage their staff around advocacy or call to actions alerts. That includes staff-wide emails, so leadership can also share resources and opportunities with their teams internally. And then for partners who want to do more public outreach as things and the environment changes, we also offer social media templates that help promote, again, voter registration and now nonpartisan advocacy campaign like the Medicaid defense one I just mentioned. And so we always want partners to reach out to us if they have a specific need or want or have ideas to chat through, because just like our founder is learning from and taking the pulse of what's happening on the ground, what folks are excited about, what folks need, we want to make sure that we are getting our partners exactly what they want to do, of course, within reason, still within our C3 nonpartisan work. But with all of that, we will offer one-on-one conversation, training, and support to see, what do you want to do? What do you want to try? Is it something in advocacy? Is it straightforward voter registration? We are going to create and craft those tools alongside you to make sure that our health centers are doing the incredible work on the ground beyond just civic engagement work, but advocacy as well.
Are there, outside of the community health centers and the health systems that you partner with, can individuals work with you all as well?
Yes, of course. So we are open to individual healthcare providers, community health workers, social workers, even professional healthcare students. So if someone's going to school, a nursing student, med students, they're all welcome to join us. We actually have different programs folks can plug into. So we have a fellowship campaign. This is a program open to all different healthcare professionals and healthcare professional students that want to learn a bit more about how to do grassroots organizing work on the ground around civic engagement. And so that's a way for folks to plug in. We also have a Healthy Democracy campaign competition that is for healthcare professional students that want to run a national voter registration competition on campus. So those are funner programs, but our tools like our badges, our custom materials, those are open to any healthcare worker. So if you work with patients or clients in the healthcare space, our tools are open to you. And again, we are always offering one-on-one training and support and resources to make sure that what is your profession? Are you working in a particular department? What is your environment you're working in? So we could figure out which tools are best for you and kind of co-create what your civic engagement plan is to help engage your community or your patients or staff or other students on your campus as well.
Wow. Listeners, I hope you can hear the passion that comes through in my conversation with Bianca and the work that Vot-ER is doing. And it really resonated with me as well as at the organization at Virginia Community Healthcare Association where I work, and why it was so important that we partnered with Vot-ER in having a conversation with Bianca, because really, quite frankly, to me, where we sit, it made it easier for us to have these conversations because there were some hesitancy, right, Bianca? We were a little hesitant. We weren't quite sure. But we knew how important our patients having a voice in their healthcare, right? And we realized that them being able to vote really did manifest good, healthy outcomes for them. And so I hope, listeners, you heard the message, right? That the message is, as healthcare providers, we strongly believe that The decisions that come out of our federal as well as our state and local governments really do impact how well we can take care of you, but then also how well you can take care of yourself, because you're giving yourself that vote, that opportunity to be heard through your vote. Hence the reason why we feel it's important that we partnered with Vot-ER, so that we could bring those opportunities to the healthcare setting for our patients. And listeners, I really hope you heard that in today's show. And so, Bianca, before I let you go, two things I need from you. I'd love for you to give our listeners the website that they can go to learn more about you. Of course, listeners, you can go to vcha.org. We have more information again on it. But if you want to go directly to Vot-ER's website, I'm going to let Bianca give that to you. But in that, Bianca, I also would like for you, if you wouldn't mind, just leaving a last word, something, that nugget outside of the other nuggets you gave us. But what's that last nugget that you can give us and our listeners today?
Well, Tracy, it's a long nugget. So is it okay?
I love it. Hey, we'll take it.
Because I really feel like it's important to end on this note. And I know because of Virginia Community Healthcare Association, there's a main thing I want to plug here. So I'll end on saying this note and then do all the good Vot-ER plugs. But I will reiterate and say this because it's the most important. If you don't vote, someone else is making those decisions for you. We need to use our vote as our voice. As healthcare professionals, you could use your vote as your voice, but the vote for your patients as well. And I think the thing that I really want to uplift is we hear a lot about civic engagement and voter registration and elections. But I want to say in local elections, especially, they're so important and so oftenly sat out while having some of the biggest, most strong impacts on communities. So when we think of local and state elections, those are the elections that can potentially influence funding for so many different public health initiatives. Things like vaccine drives, mental health or substance abuse programs, school-based health centers, and so much more that has that more immediate effect on your community. So I hear so many times that people feel like their vote doesn't matter. They feel like other people are voting the same way they're voting, so they're just going to sit the election out. My favorite story and response that I actually use to hearing people say that is an example from an election that actually happened in Virginia. Back in 2017, there was a race for the Virginia House of Delegates that came down to just one single vote, literally just one. That one vote, ended up deciding party control of the whole legislature. And with that, the direction of policy on healthcare, the direction of policy on education, jobs, all of it. That's how powerful a single vote can be. And I know on November 4th, Virginia voters will choose a new governor, and all 100 seats in the Virginia House of Delegates are up for election as well. There's a ton of local races, so no one should sit that one out. Make sure that they're going out and voting. And what's great about Vot-ER tools is you can see what's on your ballot, check your polling location so that you feel informed and prepared before heading to the ballot box. But really, healthcare professionals and healthcare folks are in a trusted position to help patients connect those dots between their health and civic engagement. Not to tell them how to vote, but just to make sure they can, to offer the resources, to offer the information, to remove a barrier to accessing voting information that they need to actually feel empowered to go vote. And that's where civic engagement really becomes that part of care. It's just about making sure people have a say in the conditions that affect their health every single day. So that will be my closing there on the importance of going out and voting in your local elections and in general, staying informed. And then to close this out, I will say, please join Vot-ER. You can learn more and order resources and tools by visiting Vot-ER.org. That is VOT-ER.org. Or you could reach out to me directly and we could set up a one-on-one so we could create your civic engagement plan and see how you could get involved. You could email me at Bianca@Vot-ER.org. That is BIANCA vot-er.org. So thank you so much, Tracy.
Awesome. And thank you, Bianca. And of course, listeners, thank you for taking the time to tune in to, again, another show, as well as a show that I really feel could really help make a difference in your life and everyone else around you. So with that, listeners, until next time.